Well, the Minister of Health, the Honorable Dr. Dwayne Sands, says healthcare workers on the front line of the COVID-19 fight are at the greatest risk of contracting the potentially deadly virus. In the Bahamas, 15 healthcare workers have contracted the virus, accounting for 20% of cases, and there has been one death. The Minister of Health shared some positive news today as it relates to a number of them recently exposed to a patient who manifested symptoms after being admitted to hospital. Cleopatra Murphy has the details.
Health officials have received the COVID-19 test results of some of those healthcare workers who were exposed to a COVID-19 positive patient unbeknown to them, and the results are encouraging.
I am pleased to say that we tested some 200 healthcare workers from PMH, and preliminarily we have 25% of the results. None of the results are positive, meaning there is no evidence that any of those exposed persons have contracted COVID-19.
Minister of Health, the Honorable Dr. Dwayne Sands, provided the results in the House of Assembly Monday, days after revealing that more than 200 healthcare workers were quarantined, among them 96 doctors and 62 nurses due to exposure. He says 43 days after the first case of the novel coronavirus was confirmed, the case fatality rate stood at 13.8%, 22 people have recovered, and there are 47 active cases. While most of the cases are in New Providence, Sands says Bimini has become a hotspot with a total of 8 cases and 1 in Cat Key.
Females account for 48 or 60% of all cases, although only 36% of deaths. Most cases fall in the age group of 40 to 59, although we have had one at 11 and one at 15.
Sands says most cases of the virus have occurred as a result of community transmission, with just 1 imported case, 4 import-related, and 75 through spread in the community. Sands says while the new norm, inclusive of lockdowns and social distancing, are daunting, the Ministry of Health has incontrovertible evidence that the measures are necessary and are effective in flattening the curve of COVID-19 in the country.
While we continue to have cases and the unfortunate deaths, we have managed to flatten the curve by having a maximum of no more than 6 cases diagnosed on any day. And our acute care institutions have not been overwhelmed with the assessment, management, and inpatient treatment of COVID cases. But we are not out of the woods yet, Mr. Speaker. We must continue the public health and social measures implemented. It is our best chance for us to make the best outcome of this unfortunate situation for all.
The Minister of Health says case identification, testing, and isolation, combined with contact tracing and quarantine, have proven effective in managing outbreaks. He provided an update on testing that health officials increased last week.
Since my last update, we have accepted 1,000 donated RT-PCR test kits, as well as more than 700 RNA extraction kits and other reagents required for testing. But despite an inventory of at least 4,000 RT-PCR kits today, we remain challenged to expand testing to reach the elusive goal of testing on demand because of international supply chain limitations.
He says to date, the country has performed approximately 1,100 RT-PCR tests. Sands also provided an update on PPE.
At this time, our stores in areas such as basic PPE kits, surgical masks, N95 and KN95 masks, visors, boot covers, and gowns is more than adequate for up to at least 1 month, and more are being procured from local and international vendors.
Sands says the Ministry of Health has spent more than $2 million on PPE, and that is expected to increase by the millions. Cleopatra Murphy, ZNS Network News.